Community Science Club, a community research collaboration to support engagement, dissemination and consumption of ageing research. Hello, my name's Dr. Catherine Broadhouse and I'm a researcher and science communicator for the Healthy Ageing Community Alliance, or HACA, and I will be presenting on behalf of the Healthy Ageing Community Alliance development team. The Healthy Ageing Community Alliance acknowledges and pays respect to the traditional custodians of the lands and waters upon which we are located. We acknowledge their elders past, present and emerging and recognise their continuing connection and responsibility to country. The economic and social costs of ageing populations are well understood, and decades of healthy ageing research have shown that modifiable lifestyle factors, such as maintaining physical and mental activity, all help to maintain our health and independence as we age. The application of these modifiable lifestyle factors means that there is enormous potential to relieve the cost of and benefit from an ageing population if research findings are translated quickly into practice and effectively adopted into lifestyle routines. Done well, community science engagement programs enable community members to gain in-depth insight and first-hand knowledge of cutting-edge research, empowering them to access relevant information about their own health journey, ultimately improving their own health and well-being. Through this mechanism, we have the ability to increase the speed at which research findings are translated to practice. Unfortunately, we have a science communication problem. There is nearly a 20-year gap between research findings and their implementation into routine clinical care and general practice. This prolonged period often results in delays in adoption of beneficial treatments and lifestyle practices, which can significantly impact the patient and general population outcomes and healthcare efficiency. This gap exists due to a variety of factors, including systemic barriers, the complexity of translating research findings into actionable practices, and poor community engagement and outreach. As we know, scientists, regardless of field, adhere to standardized scientific methods to conduct research, culminating in publication and presentation of findings in peer-reviewed journals and scientific conferences. This system ensures scientific integrity and directs research advancements. However, these scientific papers and conferences are primarily intended for a scholarly audience, not the general community, who are the intended beneficiaries of the research. The written and spoken language used is often inaccessible and unengaging to the public. Furthermore, accessing these journals and presentations typically requires affiliation with a scientific institution or university. These barriers significantly impede the translation of research findings into practice, which can take decades, resulting in a disconnect between researchers and the community. Community participation empowers people to become active participants in research and is linked to improved health-related quality of life in older adults. Unfortunately, in part due to this science communication problem, older community-dwelling adults, particularly in rural and regional areas, often have limited knowledge about the university-based research going on, creating a significant gap in understanding and reducing opportunities for their involvement. These factors collectively undermine efforts to improve health literacy, community engagement, and further delays the transition of research findings into practice. Laid out here, we have a 7-step plan to effectively promote our research. As researchers, we are really good at doing steps 2, post research updates on social media. Steps 3, network with researchers and attend conferences. Steps 4, use email signatures. And step 6, identify popular hashtags. And step 7, request your institute's PR team to post news updates. However, we are not very good, or we don't often allow for steps 1, which is find details about our target audience, which is the beneficiaries of our research. And steps 5, summarize our paper in simple language and share with the general public. Without these 2 steps, it is impossible to promote our research findings to the broader community. Fortunately, web-based platforms exclusively designed for the older adult in mind have the potential to facilitate and enhance the easy access to cutting-edge ageing research and health information. However, although online healthy ageing information is plentiful, there is a dearth of trusted, relevant and accessible information. The Healthy Aging Community Alliance, or HACA, was established to bridge this accessibility, communication and engagement gap and ensure the ongoing healthy aging research at UniSC is aligned with the needs of the Queensland community. HACA is centred around an online knowledge exchange platform, a gateway, which works with researchers, community members and service providers to design, develop and provide community-based projects such as the Community Science Club, research-based educational content, access to research studies and community feedback, all freely available online. Dr. Dana Dermody, the team lead of this project, will be talking more about the broader HACA project later this week in person in the oral presentation, Breaking Ivory Towers, a web-based gateway for dynamic community research collaboration and consumption. But for now, we're going to look in more depth at the HACA Community Science Club. The HACA Community Science Club is a collaborative science club and journal between researchers at the University of the Sunshine Coast and the community. Born out of frustration from the lack of translation to practice and partly inspired by the Frontiers for Young Minds initiative, of which I was previously a scientific mentor, the Community Science Club and newsletter is a collaborative newsletter written by researchers, reviewed by and for the community to connect healthy aging researchers at UniSC with their audience and engage the community with the latest healthy aging research. The aims of the Community Science Club are to increase public awareness and appreciation of science and innovation carried out by local Queensland researchers at UniSC working in the field of healthy aging research, to promote the importance of science literacy and critical thinking skills, to grow opportunities for scientists to engage with the community, to facilitate meaningful connection between scientists and the community in which they serve, to empower community members to access relevant information and shape future initiatives, ultimately improving the health and well-being of the community on the Sunshine Coast and beyond. And finally, to promote engagement to shape and develop healthy aging programs that align with the community's needs. This monthly science club runs face-to-face over morning tea from the Community Centre Pomona and District Community House and online. It is open to all who wish to learn about and discuss healthy aging research. From these meetups, articles are published for the HACA Community Science newsletter and online, freely available citizen science journal reviewed by the community for the community. Science clubs are promoted on the HACA online gateway, through community groups and centres and their promotional pathways, local radio and on the UniSC website. So how does the CSC work? As we have already mentioned, for many different reasons, papers published in scientific journals are largely inaccessible to the general public and in particular community-dwelling older adults. Here we can see one of the first papers translated for the journal, which describes the work and findings of Dr. Fraser Russell and the team investigating the potential of propolis found in the native Australian stingless beehive to be used as a novel scar prevention treatment. As you can see, just from the abstract, it's pretty difficult to digest for fellow scientists in different fields, let alone members of the general public. So firstly, the HACA Healthy Aging researchers and myself, the HACA Science Communicator, work together to translate their latest peer-reviewed published research papers from scientific language to an engaging language for the target audience. The idea is to keep the interesting content, but to make it digestible and fun. Through this collaboration, the scientific articles are translated into engaging, digestible draft articles written for the intended audience, the community. This draft paper is then sent to the community reviewers 1 week before the club is due to meet for the review. The Science Club then meet and the review of the draft is guided by myself, carried out in much the same way a scientific review is carried out. Science Club members learn to critically assess the scientific approach, methods and findings of the presented research, all while building on their own scientific knowledge around healthy aging. At the end, the comments, questions, feedback and suggestions are sent back to the researcher to respond and edit the draft when necessary. The amended document and researchers' responses are sent to the reviewers and they decide whether it's fit for publication. The final articles, along with the reviewer questions and comments and researcher responses, are all published online in the HACA community newsletter. The pilot HACA Science Club was launched in March and consists of older adults residing in Queensland, particularly on the Sunshine Coast, who are interested in learning more about healthy ageing research. To date, they have volunteered their time and expertise to review and contribute to the publication of 6 articles. Through their contributions, these articles are not just text but interactive online pieces with educational pop-up information, videos and infographics. Along with their insights, thoughtful comments and suggestions and observations, each article is an engaging, informative body of work that allows the reader to learn about the research field as well as the researchers behind the work. Collaborative participation by both researchers and community members in the science clubs and production and publication of journal articles benefits the broader community by 1. Improving first-hand knowledge of healthy ageing research so the individual can implement findings in their own lives. 2. Improve scientific literacy so it is easier to access and digest health information relevant to the individual needs. And 3. Increases community participation, which is linked to improved health-related quality of life among older adults. This collaboration not only benefits community-dwelling older adults, but researchers as well. So if we take a look at this 7-step chart again, we can see that through engagement, community surveys and site analytics, the HACA development team can create detailed personas of our target audience for healthy ageing researchers to accomplish step 1. The HACA Science Club then provides a meaningful way to accomplish step 5 so that findings are accessible and interesting to the general public. Providing researchers this direct collaborative link with the community enables them to promote their research field, inspire and inform the community, and increase impact and reach of their findings. Increasing impact and reach of research findings, and notably being able to demonstrate this, is crucial in successfully obtaining research grant funding. The HACA Community Science Club will support researchers to increase the impact and speed at which their findings are translated into practice. Club attendance, community involvement in Q&As, readership numbers, and offshoot community research initiatives will provide tangible supporting evidence for future funding bids. In this manner, the HACA CSC will not only engage more people in rural and regional communities in healthy ageing research, but will support researchers to obtain funding for their research as well. This direct link and feedback loop between reviewers and the researchers allows community reviewers an inside look at the scientific process and gives them an appreciation for the importance of scientific integrity and sound scientific approach, as well as the opportunity to learn about the latest cutting-edge healthy ageing research. The transparent publication of the review process, review comments, and research responses, along with the final article, allows the readership and broader public to do the same. Furthermore, every 3 months, researchers and Science Club members meet over morning tea to discuss that quarter's research articles, potential community project ideas, and future research directions. To date, the Community Science Club has already given rise to several community-based projects. For example, the Beach Access article review and subsequent publication led to a UniSC student-led project assessing the needs of older adults to improve their experience at the beach using assistive technology. And the review of the digital health technology article has led to the creation of the HACA YouTube channel, where we test and demonstrate different digital health and smart home devices. Next year, we are looking to expand our clubs to at least 2 other physical locations. If you have been inspired by this initiative and wish to start your own club, please contact us. From the HACA team, thank you for listening.